Well, hello class, and welcome to Module 10. During Module 10, we will be discussing pediatric palliative care, death, and dying. The idea of a dying child is unimaginable to most people. Injuries, cancer, and suicide are among the leading causes of death of children and adolescents. Each year, among those 0 to 19 years of age, more than 12,000 children and adolescents die from unintentional injuries. About 45,000 children die every year from all causes. Children are generally very healthy little people, and rarely a child will have a chronic illness which progresses to being terminal. During these times, children may benefit from palliative care and hospice care. These two therapies are often confused. Remember that both palliative care and hospice care provide comfort, but palliative care can begin at diagnosis and at the same time as treatment. Hospice care, on the other hand, begins after the treatment of the disease is stopped and when it is clear that a child is not going to survive this illness. At some point in your career as a pediatric nurse, you may care for a child who dies. The pediatric nurse needs to help the child and their family through this very difficult time. Nurses must respond to the child and family's physical needs, emotional needs, and spiritual needs. Nurses understand that children will respond differently depending on their developmental level. Younger children may really fear separation from their parents. Involve parents and family members in all phases of the child's care. Make sure to answer the child's questions honestly, but obviously not in a harsh way. The school-age child will have a concrete understanding, and the nurse should help the child establish some sense of control. There are many ethical issues that surround pediatric death. Children and adolescents participate in as much decision-making as they are able. Children of sufficient maturity may discuss withdrawal of treatment. Children and their parents will most often vacillate in the decision-making process. Remember that the pediatric nurse is there to support, inform, and clarify information, and not make judgments about the decisions that are made.